New videos every day.
Hi, my name is Athena Jezik. We're here for our next little series of videos today. Today we're going to do a little bit more work in explaining Cranio-Sacral Therapy. So I have a skull with me so that this can be a little bit more clear to you. This work is so subtle that it's hard to tell exactly what's going on when my hands are on the head, so I'm going to use this colorful skull in order to help to explain things. The cranial work, as we followed in a earlier video, has to do with the cranial bones themselves. So we've gone over that, and we may do that a little bit more today, but primarily what I wanted to show today is there is a part of cranial work that deals with getting the small bones inside of the mouth corrected, which helps with sometimes with severe headaches, a lot of things with the dental work that's done, temporomandibular dysfunction, having a difficult time with maybe suckling if they're infants, or swallowing, different things like that involves different bones of the body, or bones inside of the skull that are tiny to lock down and create a bit of a problem, and those bones can't always be released from the cranium. So with that, that's what we're going to be doing. I do want to explain one more thing. The most important bone is the sphenoid bone, which is this yellow bone here, which you can see from the inside. It covers all of the bones in some capacity. It's in touch with all of them. That bone comes onto the base of the skull. It looks like this, taken away underneath. It's the red and the blue bone where they're together here. Okay. What the natural motion of this is what is working with the cranial system. It's like a little pump here. It moves forward and backward. Now, if this particular bone gets off in any way, shape, or form, sideways or anything like that, particularly sideways, that's when our teeth don't hit square, because the bone is sitting sideways, so the jaw is going to be out of place. So basically the work today is going to be in balancing the jaw, balancing the mouth, and opening up some of those bones in the nasal area and the hard palate of the mouth. Okay, so to start with, for mouth work we use a glove. It's better to use non-latex and non-powder. The flavored ones only create more activation of the saliva glands, so I don't recommend using flavored ones. So what we're going to do first is we're going to go inside of the mouth on the biting surfaces of the teeth right here. We're going to be looking for the rhythm, which is going to be an expansion and a bringing back. That's the way the mouth moves. It moves up and down, the crucis suture, moving out and in. This being the hard palate on top, out and in. Okay? So by doing that with the person, is you have them drop their chin. You go in on the biting surfaces, and then you wait for that rhythm, that expansion, and so it's a flexion and extension, and it's in rhythm with the sphenoid bone. And there's a couple other directions that you take it to check to see how the range of motion is at the sphenobasilar junction. And you can get a pretty good feel as to how the balance of the body is. The sphenobasilar junction is this joint right down here where the blue and yellow meet. Right there. That's an important joint. Okay, the next one of this is you go underneath on the outside of the cheeks, or outside of the teeth. You're underneath the cheek and pulling outward. That's going to give some expansion between the maxilla, the zygomatic arch, or the zygoma, and it's going to give some expansion there and help to open up a little bit of the nasal bones. Anything else that's small inside of the nose and mouth area. So by that we just bring the chin down and go underneath the cheek, and then pull it open this direction. And then the same thing on the other side, beneath the cheek, and getting up, kind of hooking your finger in there under that arch, and then slowly and gently, without very much pressure, just expand it outward. And then we bring our finger out. Okay. Next, we're going to be inside of the mouth on the hard palate, back where the palatine is, which is these three bones that come together back here. And the finger's going to go, it's going to be an outward, forward, backward, and inward movement. By doing that, you do the same thing. You drop that, bringing the finger in and expanding outward and downward, upward. And I'm going quite rapidly for purposes of demonstration. Sometimes I will wait on the bone 5 to 10 minutes for it to move if it's been traumatized or it's in a compressed situation. If people have false teeth or bite plates, be sure that they know that they may not fit the same way afterwards because the shape of the mouth does change. And then we let it out. And to do a little more on the mouth, we go along the cruciate suture, which is in the middle of the mouth, and we're going to be right at the edge of the soft palate and hard palate, and that is going to be affecting what's called the vomer, which is the nasal bone that's deep inside here. You can kind of see it from there, but that'll correct the nasal bone. When you have infants that cannot suckle, it's because this vomer is out of place. And that's the first thing a cranial person should check if there's an infant that has a difficult time suckling. Swallowing, the same thing. And there you just give the bone a little side to side. There's about 3 grams or less of pressure. Sometimes the bones will move just with an energetic distance from it, where there's actually a space between your finger and the bone, and you can still feel it move. Which is pretty awesome. And this goes into a little torque direction as well, just to make sure that the range of motion is all really good. And then the last one is we're going to go back in and we're going to check the balance of it again. So that's on the biting surfaces. And the rhythm is good. Now she's had, even though we didn't do it for very long, she had a number of changes that did happen in her mouth. So that is how we do basic mouth work in Cranio-Sacral Therapy.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.